So my name is Anke Hensiek, and I'm a neurology consultant in the UK, and I work mainly at the University of Cambridge, but I work in specialist clinics in various other hospitals as well. So I'm originally from Germany. So I finished my medical school in Germany, but then I came to the UK. So I've been here for 30 years or so. And I'm a general neurologist. I'm a clinical neurologist. So I assess all sorts of general neurological problems, headaches, Parkinson's disease, epilepsy, multiple sclerosis, dementia, neuropathies, pain, lots of different things. I also run some very specialized clinics for rare genetic diseases, so genetic neurological diseases, and I run a few specialist clinics, which are national clinics, where I see all the patients who have these rare diseases who come from all over the country to see me. As I said, I do mainly clinical work, but I also have a research interest. So I've got a PhD student. I regularly participate in research and clinical trials. And I'm quite engaged with patient organizations, and I do a lot of teaching of medical students. So in Cambridge, there's a lot of medical students, so a whole range of different things. Well, I really love being a neurologist because it's a really interesting field. There's so much about the brain we don't understand, and how patients are affected when the brain doesn't work properly. It's really interesting. So that's the first thing. The second thing is, it is a very clinical specialty. So our kind of expertise lies in looking at the patient and really assessing the patient in a very holistic way, and really getting to know patients and examining patients. And after I examine a patient, very often I can make the diagnosis without having any tests necessary. So I like that. It's very clinical. It's not just, and in many diagnoses, there's so many different diagnoses and so many conditions which are unusual and interesting. But I think most of all I like, and that's particularly also in my area of subspecialty interest, that a lot of patients have chronic conditions, and I get to know them really well. So I see them again and again, and I really form a relationship with them, and it's nice. Often I get to know their family and their background, and I kind of accompany them through their journey of their illness in many different ways, and I really like doing that. It's and I think it often helps patients to have like one doctor who they get to know and they can kind of trust and relate to, and who knows their problems. So, and I like that as well about my work. So I have a lot of patients I've been looking after for many years, and it's nice to do that.